If you've been experiencing discomfort in your pelvic region and feel this is affecting your quality of life, you're not alone. Many men in their later years go through similar experiences. Research shows that approximately 70% of men over 60 experience some type of pelvic region discomfort. These age-related changes are quite common, and many people feel isolated with this issue. Some health experts suggest that simple chair exercises you can add to your daily routine might have the potential to support pelvic region health. If this sounds familiar to you, please write pelvic in the comments. You might be surprised to see how many people share similar experiences. Many older men today accept pelvic region discomfort as an inevitable part of aging. Experiences like frequent nighttime bathroom trips, difficulty with urinary flow, or general discomfort in the pelvic region can affect social life, sleep quality, and overall life satisfaction. In healthcare, these issues are typically addressed either with medication or a wait-and-see approach. However, some recent research suggests that regular physical activity, particularly specific exercises targeting the pelvic region, might play a supportive role in managing these age-related changes. I'm Dr. Rachel Thompson, and for over 25 years, I've been studying preventive health approaches in older adults. Today I'll share chair exercises that you can easily do at home that may have the potential to support pelvic region health in men over 60. Before we get to these exercises, I'd like to ask you to subscribe to our channel and turn on the notification bell. Each week, we share evidence-based approaches focused on practical and accessible strategies for healthy aging. And if you have concerns about pelvic region health, you can write health in the comments. I read all comments and value understanding your specific situation. These exercises will take just 10 minutes of your day. But the third exercise I'll mention shortly is the one that many participants found most beneficial. Let's begin by understanding why physical activity might be important for pelvic region health. The pelvic region is an area in the lower abdominal cavity that houses various organs. Blood flow to this region can naturally change with advanced age, and these changes may contribute to various discomforts. Regular physical activity has the potential to increase blood flow to this area. Better blood flow can mean more oxygen and nutrients transported to cells and more effective removal of waste products. This improved circulation may support the healthy function of pelvic organs. Additionally, certain exercises may strengthen the pelvic floor muscles. These muscles support the pelvic organs and assist with urinary control. With age, these muscles can weaken, but like other body muscles, they can be strengthened with proper exercises. Chair exercises are particularly suitable for older men because they are accessible even for those with balance issues, joint pain, or difficulty standing. These exercises can be easily integrated into your daily routine and require no special equipment, just a sturdy chair. The exercise routine I'm going to show you consists of 3 main sections, each with the potential to support a different aspect of pelvic health. When doing these exercises, sit in a comfortable, straight-back chair, and make sure to breathe deeply and regularly throughout the exercise. Before we begin, I want to note that it's important to consult with your healthcare provider before starting this or any exercise program. While these exercises are generally safe, individual health conditions may vary, and personalized advice is important. First exercise, pelvic tilt. Our first exercise is the pelvic tilt, which has the potential to activate the pelvic floor muscles and increase blood flow between the lower back and pelvic region. Sit in the middle of your chair with your feet flat on the floor. Elongate your spine and relax your shoulders. Place your hands on your thighs. Now, tilt your pelvis slightly backward as you pull your abdomen in, so that your lower back flattens. Hold this position for 3 to 5 seconds, then tilt your pelvis forward, increasing the curve in your lower back. Repeat this movement 10 times, holding each position for a few seconds. Continue breathing during this exercise. Don't hold your breath. The movement should be controlled and slow. Stop if you feel any pain or discomfort. The pelvic tilt can help both activate and relax the pelvic floor muscles, which is important for the health of these muscles. It also has the potential to increase blood flow between the lower back and pelvic region. Many men find the pelvic tilt challenging at first because it involves subtle movements and body awareness that might feel unfamiliar. If you're having difficulty feeling the movement, Try placing one hand on your lower back and one on your lower abdomen. As you tilt backward, you should feel your lower back flatten against your hand and your abdominal muscles engage. As you tilt forward, you should feel your lower back curve more. Start with smaller movements and gradually increase the range as you become more comfortable with the exercise. The key is quality over quantity. A few well-executed tilts are more beneficial than many performed incorrectly. Over time, this movement typically becomes more intuitive and easier to perform. Richard, 67, is a gardening enthusiast. Recently, he had to get up 4 times at night to use the bathroom, which seriously affected his sleep quality. I would wake up exhausted every morning and had low energy throughout the day, he explains. After adding the pelvic tilt exercise to his daily routine for 3 weeks, the number of nighttime awakenings began to decrease. Now I usually only get up once, and I feel more rested in the mornings. I can work in my garden longer and don't get as tired as before. What surprised Richard most was the relatively quick improvement in his symptoms. I had been dealing with these issues for years and had come to accept them as part of getting older. I was skeptical that such a simple exercise could make a difference, but I'm genuinely pleased with the results. My wife has noticed the change too. I'm not disrupting her sleep as much, which has improved our relationship. How feasible does this pelvic tilt exercise seem to you? You can share your thoughts by writing easy or difficult in the comments. Our second exercise is also quite effective, but the most powerful part of the routine is in the third exercise. One participant said, "I feel comfortable for the first time in 30 years after discovering this exercise." Second exercise, seated knee lift. Our second exercise is the seated knee lift, which has the potential to increase blood flow to the pelvic region and strengthen the lower abdominal muscles. Sit upright in your chair, with your back not touching the chair back. If your balance is good, you can use your hands to hold the sides of the chair for support. Slowly lift one knee toward your chest, then lower it and repeat with the other knee. Do 5 to 10 repetitions with each leg, keeping the movement controlled and slow. During the exercise, you should feel a slight contraction in your abdominal muscles. This can help strengthen the lower abdominal muscles, which play a role in supporting the pelvic organs. This exercise also has the potential to increase mobility in the pelvis and hip joints, which may contribute to improved blood flow in this area. For those who find this movement challenging due to hip or knee limitations, you can modify the exercise by lifting your knee just a few inches off the ground. Even this smaller movement can provide benefits. As your strength and mobility improve, you can gradually increase the height of the lift. Another variation for those with more significant mobility limitations is to slide your foot forward along the floor and then back, rather than lifting the knee. This modified movement still engages the lower abdominal muscles and promotes circulation while putting less strain on the joints. When performing the seated knee lift, focus on maintaining good posture throughout the exercise. Your shoulders should be relaxed, your spine tall, and your abdominal muscles gently engaged. This proper form helps maximize the potential benefits while minimizing strain on the back. Thomas, 72, is a retired accountant. He was having difficulty urinating and feeling general discomfort in the pelvic region. "I constantly felt tense and uncomfortable, which affected my daily activities," he says. After regularly practicing the seated knee lift exercise for a month, he noticed a decrease in his discomfort. "My urinary flow seems better, and I feel less tense. It's now easier to sit down and get up from the floor to play with my grandchildren." Thomas had tried various approaches to manage his symptoms before discovering these exercises. "I was reluctant to rely solely on medication, but I wasn't sure what else to do. These exercises gave me a way to be proactive about my health. The improvement wasn't overnight, but over time, I definitely noticed a difference. What I appreciate most is the sense of having some control over my situation rather than just accepting it." Many men hesitate to talk about these kinds of issues and may therefore feel alone. It's understandable. It can be frustrating when parts of your body that previously worked without issue no longer function the same way. However, it's perfectly normal to talk about these issues and seek support. In fact, opening up about these experiences can not only help you find solutions, but may also help others who are silently dealing with similar challenges. Many men report feeling relieved to discover they're not the only ones experiencing these changes, and sharing strategies that have helped can be empowering for everyone involved. Third exercise, pelvic floor activation. Our final and perhaps most important exercise is pelvic floor activation, which directly targets the pelvic floor muscles. Sit in a comfortable, upright position in your chair. This exercise is invisible from the outside. It's all about controlling internal muscles. Imagine the muscles you would use to stop the flow of urine, but don't do this exercise during actual urination. Slowly tighten these muscles, drawing them inward and upward. Hold the contraction for 3 to 5 seconds, then completely relax. Do 10 repetitions, giving equal importance to both the contraction and relaxation phases. The key point is to activate only the pelvic floor muscles. Try not to tighten your abdominal, hip, or thigh muscles. Continue normal breathing during the exercise. Don't hold your breath. This exercise has the potential to strengthen the muscles that support the pelvic organs and assist with urinary control. Regular practice may increase both the strength and endurance of these muscles. Many men initially find it challenging to identify and properly engage their pelvic floor muscles. A helpful tip for beginners is to try stopping the flow of urine midstream once or twice during a bathroom visit. This can help you identify which muscles to focus on during the exercise. However, this identification technique should only be used occasionally and not as a regular exercise, as it may potentially interfere with normal bladder emptying. Another common challenge is distinguishing between engaging the pelvic floor muscles versus other nearby muscle groups. If you find yourself tensing your buttocks, thighs, or abdominal muscles, try placing your hands on these areas to become more aware of unwanted tension. The goal is to isolate and engage only the pelvic floor muscles. Remember that the relaxation phase is just as important as the contraction phase. Many men with pelvic discomfort have chronically tense pelvic floor muscles, so learning to fully release these muscles is a crucial part of the exercise. Take time to feel the difference between the contracted and relaxed states. Michael, 78, is a former teacher. He had concerns about urinary control, which led him to avoid social activities. I was hesitant to go places where I didn't know where the bathroom was, he explains. After adding the pelvic floor activation exercise to his daily routine for 2 months, he noticed an improvement in his urinary control. I worry less when I'm out now and can meet with my friends more often. This simple exercise has helped me regain my social life. What was particularly meaningful for Michael was the impact on his confidence and independence. It wasn't just the physical improvement that mattered, though that was certainly welcome. It was the psychological benefit of feeling more in control and less anxious about embarrassing situations. I stopped declining invitations and started enjoying activities I had given up. My overall quality of life improved significantly. Did the way these pelvic floor exercises work make sense to you? If you understood, you can write "understood" in the comments. Together, these 3 exercises have the potential to support 3 important aspects of pelvic region health: pelvic floor muscle strength, regional blood flow, and lower abdominal support. Each can be beneficial on its own, but when practiced regularly as a routine, they may provide greater potential benefits. Now I'm going to explain the most important factor for the success of these exercises. This is an element that many people overlook, but that could dramatically change the results. Consistency is key when doing these exercises. Research suggests that short but regular exercise sessions may be more effective than longer but less frequent sessions. Aim to do these exercises at least 5 days a week, preferably every day. The reason consistency matters so much is that muscle strengthening and improved circulation happen gradually through regular stimulus. Think of it like learning a musical instrument or new language. Practicing for 10 minutes daily typically yields better results than a single hour-long session once a week. Your body responds to regular, repeated signals to adapt and improve function. To help maintain consistency, consider setting a specific time each day for your exercises. Many men find success by linking the routine to an existing habit, such as right after breakfast or while watching the evening news. This habit-stacking approach makes it easier to remember and more likely to become a natural part of your day. Results usually appear gradually over time. Some people notice improvement within a few weeks, while for others, it may take several months to feel noticeable changes. Being patient and not giving up is important. Some men have found it helpful to keep a simple journal noting their symptoms and any changes they observe. This can provide motivation when progress seems slow, as it allows you to look back and recognize improvements that might otherwise go unnoticed amid day-to-day fluctuations. Some men have found it helpful to establish trigger points to integrate these exercises into their daily routines. For example, doing the exercises while having morning coffee or watching the evening news can encourage consistency. While these exercises have the potential to support pelvic region health, they do not replace medical care for existing health issues. If you have pelvic region discomfort, urinary problems, or other concerns, it's important to consult with your healthcare providers for appropriate medical evaluation and treatment. Also, it's recommended to consult with your healthcare provider before starting any exercise program, especially if you have existing health conditions. While these exercises are generally safe, individual needs may vary, and personalized advice is important. If you feel pain or discomfort during exercise, stop and consult your healthcare provider. Exercise should be beneficial, not harmful. Beyond these chair exercises, there are other factors you might consider to support pelvic region health. Staying well hydrated is important, but timing your fluid intake might help manage symptoms. Some men find that reducing fluid intake in the evening hours, particularly in the 2 to 3 hours before bedtime, helps decrease nighttime bathroom visits without compromising overall hydration. Try to maintain consistent hydration throughout the day rather than consuming large amounts of fluid at once. This approach may help your body process fluids more efficiently and potentially reduce urgency and frequency of urination. Dietary choices may also play a supportive role. Some research suggests that a diet rich in plant foods, particularly those with antioxidant properties, may help support overall pelvic health. Similarly, maintaining a healthy weight might reduce pressure on the pelvic region and potentially improve comfort. Certain foods and beverages may irritate the bladder in some individuals, potentially contributing to urinary symptoms. Common potential irritants include caffeine, alcohol, artificial sweeteners, and highly spiced foods. Paying attention to how your body responds to different foods and beverages might help identify personal triggers that could be moderated. Stress management represents another potentially important factor. Chronic stress can affect muscle tension throughout the body, including the pelvic region. Incorporating simple relaxation techniques, such as deep breathing or mindfulness practices, alongside the physical exercises might enhance potential benefits. The connection between stress and pelvic tension is significant yet often overlooked. When we experience stress, our bodies typically respond with a fight or flight reaction that can increase muscle tension, including in the pelvic floor. For many men, chronic stress leads to chronically tense pelvic muscles, which may contribute to discomfort and urinary symptoms. Simple breathing exercises can help counteract this stress response. Try taking slow, deep breaths into your abdomen rather than shallow chest breathing. Place one hand on your abdomen and feel it rise with each inhale and fall with each exhale. Practicing this type of breathing for just a few minutes several times a day may help reduce overall tension, including in the pelvic region. For those taking medications for various health conditions, it's worth noting that some medications may affect urinary function as a side effect. If you've noticed changes in your symptoms that coincided with starting a new medication, discuss this with your healthcare provider. Sometimes adjustments to dosage, timing, or medication type can help manage these effects. Let's summarize the chair exercises that may help maintain healthy pelvic function after 60. Pelvic tilt. Sitting upright, alternate between tilting your pelvis backward, flattening your lower back, and forward, increasing the curve in your lower back. This may help activate and relax pelvic floor muscles and increase blood flow. Seated knee lift. From an upright seated position, alternately lift each knee toward your chest. This may help increase blood flow to the pelvic region and strengthen lower abdominal muscles. Pelvic floor activation. While seated, contract and then completely relax the muscles you would use to stop urine flow. This directly targets the pelvic floor muscles that support pelvic organs and assist with urinary control. For optimal potential benefits, Aim to perform these exercises daily, giving equal attention to both the contraction and relaxation phases of each movement. Remember that consistency is key, and benefits may develop gradually over weeks or months of regular practice. While pelvic region changes are common with aging, they don't have to significantly impact your quality of life. These simple chair exercises, when practiced regularly as part of a comprehensive approach to health, may help you maintain comfort and function as you age. If you found this information helpful, please consider sharing this video with others who might benefit. Many men silently endure pelvic discomfort, unaware that simple exercises might offer some support. Subscribe to our channel for more evidence-based approaches to healthy aging, and tap the notification bell so you never miss an upload. Each week, we explore different aspects of well-being for older adults, always focused on practical, accessible strategies. And please leave a comment below sharing your own experiences or any questions you might have. I read every comment and value your input. Your feedback helps guide the topics we address in future videos. Thank you for joining me today. I wish you health and vitality in your golden years. Until next time, take good care of yourself.